Okay, so good morning, students, once again. So today we will be revising on the topic of varicose vein. So now let us see what do you mean by varicose vein. So from the name itself, you can just say that vein. It's related. It's linked with vein. It's not it. So obviously, some abnormalities will be there in the veins. All right. So this is before starting. I would like to show you this picture that is the normal vein and the varicose vein. So this is the normal vein. So the veins they go upwards like this in this direction. All right. So they go in the upward direction. But in this varicose vein, what can you see? You can see from the picture itself that it's not normal, right? It's not going upwards. It's going everywhere, like it's clotting, it's blocked. It's not it. So that's why it's appearing in this manner. All right. Okay, so varicose vein, what do you mean by varicose vein? Varicose vein, they are twisted. The veins are twisted like this. They are not straight. Alright, in this normal veins, like you can see, like it's straight, like it's going very much normally, upward direction. But in the varicose vein, you can see like they are twisted. Alright, they are twisted around each other. And you can see that it mainly occurs in the superficial veins, this varicose vein. All right, it is mainly affecting the varicose vein, and it is mainly affecting in the leg areas. All right. So the varicose vein, what can you see? You can see that they are twisted. The veins are twisted. They are not straight. All right, and in the varicose vein, what can you see? You can see that they are mostly affected by the this one superficial veins. The superficial veins are mostly affected by it. Understand? And they are mainly affected in the leg area, in this portion that is in the leg area. All right, is it clear? And what happens? Okay, so this one. And what happens if someone is like standing for so long or like yeah standing for too long and all that, what happens? The in the varicose vein, what happens? They increase the pressure. It means it increases the pressure. All right, it increases the pressure of the veins which is in the lower body. So that's why it usually occurs. And in the varicose vein, what will you find? You will find that it is a part of spider veins also. So this is the spider veins. The spider veins you will find like they are thin. Okay, like compared to the varicose vein, you will find that they are thin and they are red light. Red lines means they appear to be red in color, and you will find that they are like a network of blood vessels. Understand? They are like just like a network, and it's all together. You will find, and they appear like from the name itself, spider wings. So they appear like spider. Okay, just like the webs, no, spider webs. So it appears like that, and they appear to be thin compared to the varicose vein. The varicose vein are a bit like fat and thick, and you will find they are like blue in color, and they are twisted and bulgy. Bulgy means it will puff out, it will come out, and you will find that it seems to be a bit painful, and as well as it seems to be a bit heavy. Like your leg will seem to be heavy, not like the normal leg. The normal leg will be like light. It's not it, so you can lift it up. But in the varicose vein, you'll find that they are mostly heavy, and it's difficult for the person also like to just move freely. Is it clear?
Yeah.
Okay. Now let's see the symptoms. So what are the symptoms you will find in the varicose vein? Uh, so the varicose vein, you will find that they are dark. I have already said they are dark and they appear to be dark purple or else blue in color. And you will find that they are mostly like twisted. this one. All right, they are twisted. They are twisted and they appear to be bulging, means they come out and like this it will appear. Understand? And the person might feel pain also, heavy means heavily, and also if a person will stand for too long, for a longer period of time, the pain will increase. Understand? And what happens? Uh, the leg portion, like which is mainly affecting the leg portion. All right, lower limb. What will happen there? Means it will itch. Okay, this portion it will itch also. Not only pain, it will itch as well. And apart from that, you will find the spider veins also. And the spider veins, what will you find? You will find that they appear to be thin, and you will find it under the skin surface. And yes, they appear to be in the skin surface. And the spider veins, you will find that they are what compared to the varicose vein, you will find that they are thinner. All right, they are thinner compared to the varicose vein. So these are some symptoms again. So the person will feel like burning. Burning like what? Like the person will feel uh, hot in the affected area. And next is itching. It will itch around the affected area, that is the varicose vein, will itch. And the person might have muscle cramp also, means there will be a contraction of muscle. It will pain. Okay, contraction of muscle. Then after that, what you will find? You will find that there will be discoloration in the vein, that is will appear to be dark blue or purple in color. Okay, and throbbing means the pulse will be very much rapid. It will appear to be very much fast. And the next is aching or heaviness in the neck. So the person will feel pain, and also the person leg will be like heavy. The weight of the leg, it will appear to be heavy. The weight. Okay. So we are done with the symptoms. So now let's see about the causes. What can be the cause of the varicose vein? So we can find that the causes of the varicose vein is that this is the normal vein, right? So in the veins you will find valves. Valves are like the door or the pathway. I've already said. So this is the valves. These two. So what happens in the normal vein, like it goes in the upward direction, and like they goes towards the heart. And these valves, it will prevent the blood flow from flowing backwards in the backward place, right? But in the varicose vein, what will happen? It won't, like the valves, it won't function normally, or else it won't function properly. So what happens there? Ultimately, there will be blood pool, blood pooling. Blood pooling means what? There will be lots of blood here, and as a result, what will happen? The veins will become enlarged. Enlarged means what? It will become greater in size. Even the veins also will become greater in size. Not it, because um, since there is a blood clot, then obviously like it will puff out. So ultimately, it will lead to this. And so as a result, like the person will have skin ulcers also, right? Skin ulcers. I'll show you again. So this is the blood flow in the upward direction, and this is the valve for closing. And what you will find here, there will be no like black backflow. But in the varicose vein, what will you find? You will find that the valves, they are like partly closed, like they are not like totally closed. Partly means half. So because of this, what happens? Blood clot appears. So this is stage 1, stage 2, stage 3, and stage 4. We won't discuss that much, but I'm just showing you for your understanding. So skin ulceration, this one. Skin ulceration means what? Inflammation. Inflammation of the skin occurs. So that's why it will appear to be like this. In the sense, since there is inflammation. Okay, is it clear?
Yes, ma'am.
Okay. So these are some of the causes. The causes is like what? Like in just brief, you can know that since there is no normal backflow of the blood, this is the normal backflow, like it goes in the upward direction. But in the varicose vein, you will find that since it can't go upwards because of the weakness or else because of some problem in the valves that is in the vein, so there will be blood pool. All the blood will be accumulated here in this place, and uh, ultimately it will lead to skin ulcers. So this is skin ulcer, which is inflammation. All right. Okay. Okay. Next is risk factors. So, who are at the risk of having this varicose vein? Who are most likely to have the varicose vein? Okay. So you will find that in the first one, you will find that like the person who are having like weak valves, huh? So mostly they are likely to have this varicose vein. That is, since there is, it might be because of vein damage. Since the vein is damaged, and as a result, what happens? There will be blood clot, and ultimately it will lead to varicose vein. So this one will be the first reason. Next is if a person will stand or sit for too long, like many hours, say for example 4 5 hours without any like physical activity, right? If they will stand in one particular place for too long, so they are also at the risk of having this varicose vein because it will affect the veins. It's not it, so that's why it will be effective for them. It will be affecting them. Next is being overweight, like obese people, overweight people also like they are at the risk of having varicose vein because since the lower limb the lower limb yeah, veins like they won't be able to like carry that weight means it's not in their capacity that much. So what happens? It will affect the veins. So ultimately, it will lead to varicose vein. All right. Next is pregnancy. So pregnancy also same thing. During pregnancy, a woman mostly they gains weight. So ultimately, like it's somewhat like interconnected with the like obesity. So that's why, because of all this reason, like the person can have varicose vein. Next is hormonal changes. So because of some hormonal changes also, uh, mostly it occurs in this one during pregnancy. All right. So because of some hormonal like changes also varicose vein occurs. Next is genetics. So genetics means what? Like if your forefathers were having, like if your mother, father, uncle, and all, they all were having this varicose vein. So uh, you will also be at the risk of having this varicose vein. Understand genetics. Next is aging. Aging means elderly people. All right. So elderly people, they are also at the risk of having this varicose vein. Next is female. Female. Why? Because normally the females, like the hormonal changes issue is always there. Okay, very much active in their cases. So that's why um, the females are most likely to have this varicose vein. Is it okay? Am I clear to you about the risk factors?
Yes, ma'am.
Okay. Okay, next is complications. So what are the complications that you will find that a person will have in if a person is having varicose vein? So as I've already mentioned that they will have ulcer. So this is ulcer. Here this is the failing veins means what the veins since the veins are not that much like strong enough. So yeah, that's why like it will the it will be inflamed. The skin will also be affected because of this. So ultimately it will lead to ulcer. Okay, so this is ulcer, inflammation, right? Next is blood clot. So this is the blood clot. Right? The blood is like accumulated in the vein. So the person will find like difficulty in standing and all that, because it will pain. This area it will pain. All right. So ultimately, like the person will have to go to some physical, sorry, the person should have to go to some physician, that is some doctors, like they should seek some medical advice for this if it is too much severe. And the blood clot is mostly known as thrombophlebitis. All right, thrombophlebitis also we have already discussed, right? Superficial thrombophlebitis. So that's what means blood clot is there. That's why. Next is bleeding. So it's bleeding. Okay, the veins, that is the superficial veins, like they are bleeding inside. So it will appear to be like this. And the skin may burst also. This is the skin, right? So just within the skin, like it will burst out. And all these people, na, like they need some medical attention. Bleeding. Okay. Next is prevention. How can a person prevent himself or herself during the time of this varicose vein? So first is exercising. Um, if a person does exercise, what will happen? There will be blood circulation also will be rich, isn't it? And obviously it will help the veins also in this. So exercise. A person should take an exercise. Next is watching body weight. So obesity is also included, all right, in the risk factors. So that's why the person might track his or her weight every now and then. They should limit the intake, especially all those packed food, right? All those sodium chloride foods and all that, all those preserved food and all, because like they are very much cholesterol is present there. So that's why the person, what the person should do, the person should check his or her weight every now and then. Next is they should have high fibers, and salt diet should also be avoided. Okay, low salt diet. Okay, so what are the high fiber rich foods like oats? I hope everybody knows what is oats. Then spinach, potatoes, strawberries, wheat bix is like a thin biscuit type. Okay, it's made of wheat. Next is lentils. Lentils are mostly dal and all that. Okay, moong dal means all this dal, kind of dal. Next is almonds. So almonds also is like rich in fiber. Next is banana. Next is orange, corn, then wholemeal bread, then chickpeas, all this chana and all that chickpeas. Next is peas. Next is quinoa. I hope everybody knows quinoa. It's a kind of a seed. Okay. Next is broccoli, and the last is apple. So in all this type of food, there contains sufficient fiber. Then the person should consume like this kind of diet. All right, is it clear about the diet? And they should have low amount of salt, low sodium. Like they should have fruits, then vegetables, grains, and all that. Then meat, fish, beans, some dairies, and all that. They should have low sodium diet. They should not have all those chips and all that. All right, because in chips and all, what happens? It contains a large amount of sodium, so that's why it will lead to obesity. So the person should not have like high in like sodium. All right, and next is mm, they should avoid wearing high heels, especially for a woman, female. All right, because what happens if they wear heels, they will give pressure. So they will give pressure, and ultimately what happens, it will affect the veins also. So that's why they should not wear like this kind of uh, shoes. Next is the person might the person can lift up his or her leg in this manner, so that there will be proper blood circulation. and the person should change the position like every now and then. Okay, the person should change his or her position every now and then. It's not that they will sit or else they will stand in one particular place for too long. Like they should change every now and then. All right. Is it clear about varicose vein, everyone?
Yes, ma'am.
Okay. If it is clear, then uh, Krishna, am I audible?
Yes, ma'am. Yes, ma'am.
Krishna, can you tell me varicose vein is affected? It's mainly affects what type of vein? Superficial or this one, deep veins?
Ma'am,
कौन सा veins ज़्यादा affect करता है? Superficial veins या deep veins?
ma'am, depends.
Deep veins. Are you sure?
Ma'am. Ma'am, superficial.
Superficial.
Hello, ma'am.
Sure.
Yes, ma'am. Yes, ma'am.
No more changing, na?
No, ma'am.
Okay. Yes. It is correct. It mainly affects the superficial veins. Okay. Okay, next question goes to Surajit. Surajit Kalita. Okay,
Yes,
Surajit,
ma'am.
can you tell me varicose vein in which part it's mostly affected? In the hands, legs, where? Leg, na? Okay. Okay, good.
Yes,
Okay.
ma'am.
Okay. Next question goes to Srijana. Am I audible?
Yes, ma'am.
Okay, Srijana, can you tell me any symptoms of varicose vein?
Ma'am, skin discoloration,
Huh?
itchiness,
Huh?
hardening of the vein,
Hardening. Are you sure about hardening?
ma'am,
Okay, continue.
dark purple coloration,
Okay.
and pain in the affected leg.
Okay. Okay, good. Okay, next question goes to Sheetal. Sheetal, am I audible?
Yes,
Sheetal.
ma'am.
Okay, Sheetal, can you tell me some causes of varicose vein? It is mainly because of what? Because of what? Varicose vein is mainly occurring, or else it is mainly, yeah, occurs because of what?
Weak or weak or damaged valve.
Weak or damaged valves. Okay. Okay, good. So normally, like it goes upside in the upward direction, right? Like the veins, like going towards the heart, like this, upward direction. But in the varicose vein, because of the weak and the damaged valves, what happens? The blood will clot, and there will be blood pool. Blood pool means all the blood will like accumulate in one particular place. Understand? Okay, next, Senkamchi, am I audible?
Yes, ma'am.
Okay, Senkamchi, can you tell me some of the risk factors? Who are at the risk of having this varicose vein?
Ma'am, pregnant woman.
Huh?
Hello, ma'am.
Yes, I can
Pregnant
hear you.
women,
Huh.
aging,
Aging means age.
Uh,
Okay, okay, you have said two. It's okay, fine.
this one,
It's
pregnant
okay,
women.
it's okay, Sankamchin. I have already got the answer. Next question goes to Rudolph. Am I audible, Rudolph? Rudolph? Rudolph?
Yes, ma'am.
Okay, Rudolph, can you tell me? She said, Sankamchi said age. Alright, means elderly people and pregnancy. Any more other points which you would like to include?
Hello, ma'am.
Any more points which you would like to include?
Ma'am, causes, you mean?
No, no, risk factors. Who are at the risk factors for having this varicose vein?
Or like prolonged sitting and standing in same position.
Okay, that one to it is, but I'm asking the risk factors. Like, who are at the risk factors? Like, I'm asking like age and all that, na? Like,
O-
woman, like this type.
over 50 years old and pregnancy during pregnancy.
Anything else?
During pregnancy
Huh?
and uh,
Genetics. It's
and
not it.
yes, yes,
Hmm.
ma'am.
Then hormonal changes. Then obesity. You forgot all those.
No, ma'am.
Okay, okay. So all those are the reasons. Understand risk factors.
Okay, ma'am.
Okay. Next question goes to Rashmi.
yes, ma'am.
Okay, Rashmi, can you tell me some complications of varicose vein? Complications.
Ma'am, blood clot, ulcer,
Hmm.
um,
Then,
ma'am, bleeding.
okay, bleeding. Okay, good. So these are okay. So this is ulcer, the first picture. That means inflammation will occur here. All right. And next is blood clot. Like there will be blood accumulation over here, and the person will feel pain. Understand? And that blood clot is known as thrombophlebitis, which I've already discussed. Next is bleeding. Just underneath the skin, like just nearby the skin, it will bleed. So it is good. Okay. Next question goes to Finisha. Finisha, am I audible?
Yes, ma'am.
Okay, Finisha, can you tell me prevention part? Any two. Mention only two. It will be enough.
Exercising,
And
eat, eating a high fibers and low salt diet,
okay, good.
and
Okay, two is
avoiding
enough. Okay, okay, it's okay. Next, Nafishisha,
Yes, ma'am.
add two more points.
And avoiding wearing high heels or tight socks and stockings.
Okay, okay, it's
And
okay. Okay, next, Mercy, add two more points. Mercy,
Yes, ma'am.
okay, add two more points.
Ma'am, changing the sitting or standing position regularly and by elevating the legs.
Okay, okay, good. Next, Malvina.
yes,
Malvina,
ma'am.
okay,
Yes, ma'am.
Malvina, can you tell me some names? Even though I didn't, I have not given you in the notes, but I have shown you the picture, right? So can you, like, if you remember, can you please tell me what are the food which is rich in fiber?
And oats, chana, bananas, corn,
Oats, banana, then
chana.
chickpeas, na? You say chickpeas.
Yes, ma'am.
All right. Chana is like what to say, our local. For our understanding, we say chana, but in English we usually call it chickpeas. Okay. Okay. Next, Ishan. Am I audible? Hello.
Yes, ma'am.
Okay. Can you add some more, which is rich in fiber? I've shown you some pictures, right? So if you remember, you say
Broccoli,
broccoli. Okay.
apples,
Anything else?
ma'am, beans,
Beans. Okay. Add one more.
apples.
Apple. Okay.
Yes, ma'am.
Okay. Good. Okay. So these are. You can take a screenshot also if you want. So all these are high fiber foods. All this. All right. Okay then. I hope you all have understood for today's class. That's all for today's class. Thank you everyone. Srijana, you please give me the attendance for fourth sem and give me okay, you give me for second sem. Darshana. Okay. And Srijana, you give me for fourth sem.
Okay, ma'am.
Okay. Okay then, thank you everyone.